everybody. Thank you. We haven't had a IG Live Monday Meals event in a really long time. And so I'm so excited because actually this is the first time we did our Monday Meals event out here. And I'm going to turn it around so all y'all can see. My bad, y'all. We are out here at 3600 Broadway in front of Kaiser, where the NUHW folks are out here on strike. And I have Sabrina here who's joining me today. She's a worker and she's out on strike, and we're going to talk a little bit about the strike together so we can learn. Y'all you can learn how to support, you can learn how to get involved, and why this is so important, not just for the workers here, but for all workers. But we haven't had a Monday Meals in a while, so I'm going to give folks a little bit about what Monday Meals is. We do this IG Live, and basically, I grew up in the movement where I talked with my people. We sat around and we ate food, sometimes at lunch, and I'm sure you still do this too, where you just talk to your people about like what's going on, what's important to them, and why, so that we can all learn and then figure out ways that we can plug in. And it's called Monday Meals because we do it during lunch on Mondays. And I used to do this thing where for a while I was doing the side hustle where I would cook all day on Sunday and then I would deliver meals on Monday. Got it. And so when I did that, I also got to check in with people, like, how are you doing? What's up with you? So we adopted that for this. So I'm really glad that you're here. So it's all about nourishment. It's about nourishing our minds, nourishing our bodies, nourishing our hearts. And so we always ask everybody who joins us to introduce themselves and then to basically tell us what you're having for lunch. If you're having lunch today, we encourage you to have lunch, even though you're on the picket. But then also, what are the ways that you nourish yourself, your body, your heart, your mind? Because we try not to think about it like self-care is like this one-time thing, but it's like, how we do it all the time. So,
Yeah. So my name is Sabrina Chaumette. I'm a therapist in adult psychiatry, Oakland. I've been in practice 25 years. We do have lunch provided whenever we're out on the picket line. I think it's sandwiches today, which is lovely. The ways I nourish myself to be able to do my work is I've had a long yoga practice for about 20 years. And I love to go on yoga retreats because it allows me to get out of my head into my body. I love to dance. I was taking Zydeco dance lessons before the pandemic. So those are the ways I nourish myself. Plus, being social. It's important, I think, as a therapist to also have a healthy social life. So I'm not just focusing on the needs of others, but my need to also be fed by my community of friends.
That's right. I really love that. People aren't honking at us. They're honking for the picket to just be supportive. But what's Zydeco dancing?
So Zydeco dancing is done in Louisiana. It's partner dancing. It's very fast. It probably takes things from swing and from the waltz. It's just wonderful partner dancing, and it really allows you to connect with other people. It's touch. It's really using your body rather than voice, like you have a leader and a follower. And it's just a lovely way to express yourself, learning how to work with the body.
Ooh, I'm going to have to check this out because that sounds so much fun.
It is a lot of fun. There's a lot of laughter. It's easy. There's usually a live band.
Yeah, live music. Yes, that's what I'm talking about. Thank you for sharing all those different ways. And I think a lot of people tend to think self-care is that moment where you just for yourself and you go into yourself and spend time alone, but it's so important, I think, to connect with people. And this is why we do this too, is because it's we want to really talk to folks about what that means, because we are in community with each other constantly.
And that's where we really suffered in the pandemic, because when we went into lockdown to be medically safe, we lost community, we lost connections.
That's right.
One of the number one things we're treating right now is not just anxiety and depression, but loneliness.
Right.
So being in community is, your community helps to check you, your community helps to validate you, your community helps you know that you are worthy and welcome of care. And so
talked to some folks from NUHW last year, I believe, when the engineers went on strike and the other folks went on strike against Kaiser as well, to get a fair contract. And so this time it's you all, and it has been a long time.
Yes, we are in week 5, and for a long time we've been saying, but certainly the pandemic highlighted that both wheels fell off the car, that patients in mental health don't get the same kind of care that they would in primary care. Primary care has more resources, more support staff, more providers. So for me, it's a civil rights issue. It's separate and unequal access to care.
Can you say a little bit more about what you mean, why it's a civil rights issue? Because I think a lot of people don't, I mean, it's still, I feel like there's a lot of folks talking about, oh, I go to therapy and I do all these things, and, you know, but why is it so important for mental health to be at par with like physical health?
Well, when I think about the people we serve, especially in inner cities, they are poor people of color. They might be marginalized, experiencing all kinds of isms in which they have been separated from society or said that they are not worthy or welcome. And so to the people who need the most, they get the least. If a person knows how to advocate for themselves, they can, and they've got resources, they can go to an outside referral for their therapy. But if you're poor and you're overwhelmed, you're not going to be seen as often as you need. And we see a lot of trauma.
That's right. That's right. And so that's one of the things. And so, you know, I'm wondering if you could tell a little bit about then why did you all decide to go on strike, right?
It became very clear that when we were saying that we are asked to see too many patients, that the return time can be 4 weeks to 8 weeks out, that the patients finally are just beginning to start treatment after waiting to see, after the intake. They wait for initial intake, it can take 3 months. And then
3 months?
It can take 3 months. And then when they're finally seen, then they're told it's going to be 5 to 6 weeks for the return because we're overwhelmed. We don't have enough providers for the patients we serve.
Right. That makes sense. I mean, I think even for myself, I have Kaiser. I receive Kaiser as a benefit for my health insurance, and I choose not to go to Kaiser because that experience has been my experience. Like, how do I find, you know, like the access to getting the care is not there. You know, and the wait time is so long, and oftentimes it's like what I experience is so acute. It's like right now, and you know, I don't have time to wait 6 weeks when I could probably find a professional, not through Kaiser, and just pay out of pocket. And I'm fortunate to be able to do that, but I know that a lot of folks aren't, and that's not. And that just doesn't feel right to me.
And the model isn't honest. When people sign up for the health insurance plan, they think they're going to be treated in mental health the same way they're treated in primary care, that you can always access a provider. There's always somebody there available to meet with you. But when they contact psychiatry and they hear about a model of care that is solution-focused, episodic, group-based, and that there's long wait times, I think they feel lied to, deceived.
And so what are you all demanding with this contract? And because I think a lot of people, and this is something that I think is perpetuated by corporations, by big business, right? And to be really clear, Kaiser is a big business, right? And it's one of the biggest in Oakland, is one of the biggest in the West Coast, is that it's selfish, that you're only thinking about yourself, and you're just really trying to get a better pay, right? And I think a lot that's like perpetuated as a myth. And so I'm just wondering if you could talk a little bit about what that means for you, because it can't be an easy decision. Y'all, they've been on strike for 5 weeks. Like, that means they're not getting paid. So we'll talk a little bit about how you can contribute to the strike fund, but like, that's really important, I think, that to debunk those kinds of myths.
Right. So one of the things we're asking for is for the ratios to change.
Okay. We
would like a 1 to 6, so news to return, so that people like you who need a follow-up appointment can be seen within. SB 221 said that people need a follow-up appointment within 10 days of the initial appointment. We can't do that when our numbers are so high. We get new patients every week. The patients that we serve are moderate to severe. The patients who are mild go into the community. So if all your patients are moderate to severe, and that's what we have in the pandemic, they can't wait a month or 6 weeks for the return appointment.
Right. Oh, wow. So it really isn't just about you all, trying to just look out for yourself. You really are looking out for the patient. I mean, it is important for you all. Thank you, I appreciate it.
Especially.
It's important for folks to know that, like, it is important to support our workers. It's important to have our mental health workers be able to work in conditions that work for them and keep them healthy too, right? Because you don't want to work at a pace that is unsustainable.
And it's unsustainable because despite the great pay, and we are paid very well, people are still leaving. So if it was really about the pay, we would never lose providers. We are so understaffed. We cannot fill positions. They have recruiting bonuses that went from $2,000 for a sign-on bonus to $5,000 for a sign-on bonus. The sign-on bonus is now $10,000.
What?
Yes. We've asked, what about retention bonus for those of us who've been here, who can work here, who've ridden out the pandemic? They're refusing to discuss retention bonuses.
How long have you been working for Kaiser?
For 15 years.
Wow, y'all, I think that says a lot about who you are, Sabrina, and like your dedication to the work. But to feel like Kaiser really isn't prioritizing its workers, and it's so ironic because when I came around the corner, it says, what does it say? Equity for health?
Yeah.
Health is equity, or equity is health, and we all should thrive. And I was like, well, that's really ironic because they're not being very equitable.
Right, and this is why I see it as a civil rights issue, because separate, before, Plessy versus Ferguson said that schools could be separated and they would be the same education that blacks would get, that whites would get. Kaiser treats mental health the same way. It separates mental health from medical, but yet the patients in mental health get less resources than patients in medical.
Woo! So, what else is in the contract? Like, what are other things that you're working on getting? I think I hear you saying you want more
providers. I want them to do things that will recruit and retain providers. They are trying to recruit, but no one wants to work here. So we are asking for more.
They know the conditions.
They know the conditions.
Right.
They know the conditions. So improving the bilingual pay. Those are the kinds of things that we're looking for.
And that's oftentimes like the one place that folks, or monolingual speaking folks go is to hospitals, right?
They go to hospitals, they listen to the primary care doctors who say, I think you need a therapist because you're experiencing depression. And so they follow their doctor's order. And they would love to walk into the clinic and speak to somebody who looks like them, who understands their cultural background, where they don't have to explain things.
Right. And that's so important. I think like that being able to provide like culturally competent mental health workers and care is really important. Like when I think about like my own parents, right, as immigrants themselves, and it's really funny because I remember one time I went to the doctor. We went to the doctor together, and I went out to the bathroom because the wait was so long, and I came back in, and she was speaking to the healthcare provider in broken English, and I was like, she's doing fine. So I stopped. I just was like just sitting there, and then she immediately moved into Korean because she was like, I was like, you were doing okay, like why do you suddenly need me to translate for you? And she goes, because I can't be my full self in English. And so I think that's so important to, especially when you're talking about your mental health, you're talking about depression, and you're doing talk therapy. It's so important to be able to express yourself fully and be your full self and to be understood.
Right. And if you're talking about trying to help people through social trauma like AAPI, those patients do need to see somebody who that could happen to also.
Right.
Or if I see a black family and there's been a shooting in the community, they want to be able to talk to black victims. They want to know that you're going to understand what they're going through, or how afraid they are to leave the house, or how afraid they are to send their kids to school. They want to know that you get it intrinsically. That it could. Actually, I've had patients say to me, the reason I wanted to see you is because I know that this could happen to you too. So I don't have to explain to you why this is so scary.
Let that one sit with your heart right now. Like feel that in your being, because that says a lot. It says a lot about like just your presence I think a lot of people talk about representation matters, but it's also about the experience, the lived experience that you come with, that is so important. I really appreciate you sharing that with us.
Well, you're welcome. So that's what it would mean to be empathetic, which is it's happened to me, versus empathetic. I can say I'm really sorry that you're going through this, or I've never lived your experience. But empathy is, this has happened to me. It could happen to me or somebody I love, so I know exactly why this bothers you, and I'm scared too.
Wow, I really appreciate that. Like, you know, I thought, oh, I'm just going to come out on the picket and it's just going to be like chanting and all of that, but you really have taken this issue and the whole purpose of the strike and made it so meaningful. I think this is the part that I think a lot of people tend to forget when it comes to labor and workers' rights, right? Is that that they're not talking about like the heart. It's really about the heart, and people really want to do work that is meaningful, that it isn't just about a paycheck at the end of the day.
And people want to feel, we never came into the field to harm. We came into the field to help and heal. And every time we have to tell a patient, I'm sorry, I can't see you for a month, even though you've just told me about the most painful thing you're going through, we feel like we're hurting them. There's something in therapy called moral injury. Like I am doing and I am participating in something that I know is harming you. So we all discuss this as providers, feeling that we're morally injuring our patients because we're treating them with the infrequency that we know cannot help the trauma, the depression, the loneliness, the anxiety, the PTSD that can't help them.
Yeah. Oh man, I really appreciate that so much. And I just want to say, like, my battery is dying. So just in case this cuts out really quickly, I want to make sure that folks know where to go, because again, folks are, and I'm going to turn this around so you can see, folks are having their lunch here. You know, they're on the picket, and this going on 5 weeks.
Yep, this is week 5, and we're actually stronger. We're stronger. I think Kaiser was hoping to break us, that they would break our resolve, that we would splinter off. But I tell you, the longer we're together, it's actually doing the opposite, because we're organized, we're getting a chance to talk to each other, we're supporting each other, and we're really noticing how little, not only do our patients matter, but how little we matter. Because if the patients were so important to Kaiser, why wait till week 4 to begin bargaining and then tell us you can't bargain?
What did you say?
Yeah, they didn't come to bargaining until last week. They did not respond to our 2 letters asking for them to bargain.
Kaiser, you really need to do better, because how could you really be like, I am for equity, I am for our patients, if you didn't even want to come to the table to talk about that? To me, again, shows that at the end of the day, places like this are really about the bottom line.
They really are, because they didn't come to bargaining till Thursday of last week, week 4. They refused to bargain over the weekend, saying they didn't have permission to talk about issues. They offered us a bargaining day. I would have hoped it'd be Monday today, because the patients matter. But no, our next bargaining day is Wednesday. Wednesday within the 5th week. That doesn't show, it's not talk, it doesn't show that our patients have equity, and it doesn't show that our patients matter.
That's right, and I think that's so important for us to really understand what that means. So, you know, when workers are with a union and they get a contract, it's for a certain period of time. And a lot of folks tend to think that a labor contract is just about the workers and their pay, but it is also about being able to get working conditions for themselves and for the people that they service and work for, that is both safe and equitable. And so I really appreciate the way that you framed a lot of why you're on strike and why folks have really come together on this. And it's so great to see the level of energy that really is out here. And as you all have probably heard, people driving by and honking this entire time, because I think they really believe that this is important, not only for themselves, but for the whole community, because, You know, when you care for one, you care for all.
You do, and when our patients are overwhelmed and they don't know how to manage systems, you can't expect them to figure out how to fight for their care, so we are doing it. And we've been really creative and very grassroots. We've been doing TikTok videos. I, as a therapist, would never have thought.
So find out their TikTok. What's the TikTok?
Oh gosh, I don't remember. Long as possible.
Okay, y'all, so you need to go find it on TikTok. Go find NUHW, which is United Union for Healthcare Workers. Go find their TikTok because they're doing dance videos. I saw them when I drove by, and y'all, it's really fun. Most unions do have a strike fund, but even if they did, going into the 5th week, it still isn't a full pay, or it's not really taking care of folks. And so I know that there is a GoFundMe out there, and so if you have that GoFundMe information, we could definitely share it. If you don't, we'll find it and put it in our bio.
If you would find it on the NUHW website, it'll tell you about the GoFundMe. We really do need the support because we're trying not to give up, and so we're asking the community not to give up on us, because part of this fight is it's a long fight. It's not the short game, it's a long game, and we have to be able to endure.
Yes, so let's say that one more time, that without your support, they can't really do what they need to do. So if you really care about mental health, you really care about workers, you really care about being able to provide health care and mental health care that is equitable for all, go to NUHW's website and follow their TikTok. Go to their GoFundMe page and then support. Drop whatever dollars you can, because at the end of the day, that's what we need to be doing, is to be able to take care of ourselves. If there's anything we've learned during the pandemic, is that we really got to take care of each other, because that's the only way we're going to get through all this. So, my battery's about to die. It's usually go much longer on this. But I really appreciate your time, Sabrina, and I really appreciate the way that you so clearly framed for us. And there's more supporters, y'all. Really framed for us and for our supporters what this strike really means. And thank you so much.
You're most welcome.
Yeah. So, if you go to NUHW to support, and you can follow us, oaklandrising.org. You can donate to us /donate. You can also sign up to our newsletters at oaklandrising.org. Y'all, election time is coming up, and we really need to be thinking about what are the ballot measures that are moving in Oakland that hold corporations and organizations like Kaiser and other places accountable in Oakland. And so be sure to follow all of those things and be in touch. Thank you again, Sabrina.
You're most welcome. Thank you, everybody, because we live in the community like you.
Yes. That's the one thing I think a lot of people forget, right? Is that your next door neighbor are the people who are working with you, beside you.
Right. The pandemic affected us too.
Yes. Appreciate that. Thank you. I appreciate your all the ways that you nourish yourself too.
Yeah, thank you.
So if y'all didn't learn it, y'all should go back to the beginning, watch this video again, and learn the ways Sabrina really takes care of herself, because I want to join the dancing. Okay, thanks y'all. Have a great day.